Today's topic is muscular dystrophy. This is a group of genetically determined, progressive, degenerative myopathies affecting a variety of muscle groups.
Joy filled our hearts when Ishu was born. Gradually she showed signs of impaired physical development, until finally her diagnosis of spinal muscular dystrophy was confirmed. For 5 years, tender, loving, affectionate care and exercises kept our hope alive. After 5 years, we began to accept reality. Ishu had serious physical limitations. Ishu at 9 years welcomed baby Monica. In time, Ishu shared our griefs. Monica was even more critical because she has spinal muscular dystrophy with contractures resulting in frequent respiratory distress.
Spinal muscular dystrophy is an inherited disorder. It may be X-linked, chromosome X. It is a genetic coding defect causing abnormal muscle development and function. Neurological examination helps confirm diagnosis.
A profile of Ishu and Monica, two sisters, provides a baseline for meaningful study and interaction. It highlights the individuality of every patient's psychophysiological response to muscular dystrophy and the importance of care based on need differences as well as need similarities.
Profile of Ishu. Ishu's diagnosis was progressive muscular weakness. Her clinical test revealed weakness of proximal muscles. All deep reflexes were depressed. Sensation normal, but there is significant motor deficit. She has fairly good intelligence. Her plantar is reflexor, and there is intercostal wasting. She has universal absence of reflexes. By observing Ishu, it was seen that she rolled, crawled on all fours, stood, took a few steps, floppy, profound neck muscle weakness, weakness of both upper and lower limbs, reflexes absent. Profile of Monica. Monica's diagnosis was quickly confirmed as spinal muscular dystrophy type 2. Her clinical progression showed that she never walked. She had progressive weakness of both upper and lower limbs, developed a marked hunchback, and supports her head with a hand.
How far have I come along life's way? Where am I going? My responsibility is to be self-independent. I will not allow my determination to be destroyed. How can I prevent my mind from being destroyed? I want normal independence. Education begins at birth. From the beginning, one of the greatest lessons my parents taught me was perseverance. My grandfather was my very best teacher, continually encouraging me to study, to press on, to enjoy reading and learning. A few teachers analyzed my disabilities and encouraged me to be a normal person. There was no provision for my participation in school activities. Delhi University did not cater for wheelchair users as higher institution of learning should. While missing out on campus life, college by correspondence did lay the foundation for self-disciplined study. Aptech, where I took professional training in computers, is very accessible for wheelchair users. This was my first really serious study. At the same time, father was training me to do work on his computer. I still remember the joy in his voice and on his face when he saw my first printout.
Well done, Ishu, well done, Ishu. Look, Ishu has taken out her first printout.
We all need to be inspired. At 22, with my parents' backing, I opened the SBL Computer Training Center, which is real continuing evidence of their love and encouragement. By managing and developing every aspect, my confidence, security and satisfaction increased. My first earning of Rs 125 made me so happy I had been convinced I would never be able to earn. Then I realized as never before the value of money. At SPL, the basis of our teaching is that each student understands the reason.
Ishu's parents were wise in the way they built confidence by helping Ishu to do. Their aim to inspire bore fruit as Ishu rapidly developed confidence. Financial security did not prevent parents from helping Ishu to stand on her own feet, though confined to a wheelchair.
Just think, nurse, how, when, and why do we learn? Learning can be for fun, service, freedom, energy conservation, staff productivity, quality patient care, professional accountability, maintaining one's integrity, fulfillment in nursing. True learning is both a joyous and a painful process. The evidence of our learning is expressed in our deeds.
Who would you consider to be significant people in the development of SPL?
Jackie and Ravi, they introduced me to the students, foreigners and some of the embassy's staff.
How did you meet Jackie?
I've heard about the organization maximizing employment to serve the handicapped. I rang them. Jackie was the only person in whole of India who did not ask about my disability certificate. She wanted my skills. MASH helped and encouraged me the most.
Jackie is a nurse administrator with a deep concern for the welfare of people with various limitations. Ravi came to learn how to manage financial accounting on the computer, which has now been successfully implemented in MESH. Community health is much more than band-aids and vaccinations. It is a genuine concern for the care of the whole person. Nurses, doctors, and other professional health workers are responsible for helping parents and Ishu to maximize her functional ability. Key factors in the management of anyone with spinal muscular dystrophy are exercise physiology, mental stimulation, emotional stabilization, spiritual maturity. Basic anatomy and physiology help us understand where the special characteristics of the muscles have been interfered with during the developmental stage.
Muscular system. The muscular system specifically refers to skeletal muscle tissue usually attached to bone. Its function. It powers movements of the body. It stabilizes body positions, sitting with body correctly aligned, and it generates heat. Its 5 key characteristics are excitability or irritability, muscle response to stimuli from chemicals, neurotransmitters released by neurons, or hormones distributed by the blood. Conductivity is when muscle cell or neuron conducts action potentials along the plasma membrane. Contractility occurs when muscle tissue shortens and thickens, that is, contracts to generate force. Extensibility is when muscle can be extended or stretched without damaging the tissue. And elasticity is when muscle tissue returns to its normal original shape after contraction or extension.
Passive exercises by an understanding person, Ishu's parents or physiotherapist, are essential, even though the power of movement does not return. For example, Ishu is unable to adjust her own body positions. Mental stimulation takes many forms apart from formal learning.
Part of my strong desire for independence is to contribute to group activities organized by the handicapped. This is an area of difficulty for my parents that we are working through.
Emotional stability is a complex yet integral part of maturation dependent on a healthy nervous system.
Nervous system. The brain and spinal cord are continuous and together constitute the central nervous system. 31 pairs of spinal nerves, each connected by roots arising from a specific spinal segment, are the parts of communication between the spinal cord and most of the body. The anterior or ventral root contains motor neuron axons and conducts impulses from the spinal cord to the periphery. The posterior or dorsal root contains sensory nerve fibers and conducts impulses from the periphery into the spinal cord.
Books are one of my greatest aids. It is a skill to understand the emotions of my family, who are my key helpers, to know when to make a request without causing a negative reaction, which the person may try to hide while helping. I may like an extra bath, but that involves a lot of effort on someone else's part. There is a fine balance between my self-perceived need and my ability to consider the effect of my need being met on others.
To maintain emotional balance without becoming withdrawn or demanding requires an understanding of the spinal cord function and a lot of grace. Grace that can endure discomfort and be loving in the presence of an overwhelming unfulfilled desire.
Spinal cord physiology has 2 principal functions. The white matter tracts are highways for dispersing nerve impulses. Along these highways, sensory impulses flow from the periphery to the brain. Motor impulses flow from the brain to the periphery. The grey matter of the spinal cord receives and integrates incoming and outgoing information.
My emotions are more intricately related to my family and helpers' emotions than if I were independent. Management of conflicts greatly influences my mental state of depression, my sense of worth, and my attitude towards suffering.
Nursing touches the heart. It senses and recognizes the deepest unspoken grief, emptiness, and aloneness. Depression is not one thing, but many. To help alleviate depression, we need insight into its nature and into the heart of the depressed person. No single theory can alleviate every depression. Love and resentment towards someone on whom we are dependent or who is dependent on us occurs because there is a definite relationship between body, mind, and spirit, and mind, heart, and will.
The skeletal system. All the bones of the body, their associated cartilages, and the joints support and protect the body, assist in body movements, house cells that produce blood cells, and store minerals. Bones and flesh distinguish man from spirit. The spirit of man influences the health of his bones and flesh.
A glimpse at the inner Ishu and her family will help us more effectively contribute to those experiencing depression that can be managed or overcome without medical intervention.
From about age 15, I have had to contend with depression. Shyness has been a constant battle for me. My dependency on others for feeling of helplessness and a deep concern what will happen, leading to an inner insecurity. Deception creates problems. For example, when students defy instructions and insert virus-infected disks into the computers, knowing I cannot see them, or those who took a full course then left without paying. I get very depressed over Monica's condition. Her contracture causes increased hunchback and respiratory distress, which makes her struggle for breath. To prevent Monica from seeing me down, I have developed an attitude to increase her confidence and encourage normal interaction with all people and situations.
Masked depression may manifest itself through compulsive behavior, including overwork.
I take only one meal a day because I can easily put on weight, which would create big problems for me in the wheelchair and for everyone who helps me. It would also make me very depressed. When I find myself enjoying hot tea, I purposely leave it till it is cold, or I will choose something else. When reading a lot, I really enjoy reading. I switch to music to make sure I keep a balance.
Ishu shows maturity and wisdom in controlling her appetites by not becoming too set in her routines, and protects herself against unnecessary stress when her desires cannot be immediately met. However, Ishu also needs to be kind to herself, to accept and love herself without feeling guilty when really enjoying something. What has helped you most to deal with depression?
Nursing with a difference module. I'm not a medical person, but I found them reader-friendly. I could relate to the feeling of nurse and patient. They helped me a lot. And also the comment by the nurse, we change but God does not. How can we use our resources more effectively? By letting God's power work in us in each situation. On asking about the meaning of suffering, the nurse response, and with the help of Bible, I found my approach and attitude toward the suffering and depression change, and gradually it becomes more and more positive. I never associated my suffering with the glory or with the peace and hope. I always look forward to when I could get rid of this wheelchair, no matter how long it took.
Causes of depression, including various degrees of postpartum depression, 4 times for mother, began before Ishu was old enough to understand.
I understood the need for exercises, even if I was tired, worried, and not well. I knew exercises were a must for Ishu, though they showed no result. Ishu was 9 when Monica was born. Within 6 months, by neurological examination, doctors confirmed Monica's diagnosis.
6 components of neurologic examination. Cerebral function indicates mental status. Cranial nerve function. Cerebellar function. Motor function. Sensory function. Deep tendon reflex. The symmetry of function and findings of both sides of the body is important to note. Always compare one side of the body with the other side. Note the degree of motor strength of, for example, the right biceps with that of the left biceps.
I was shocked. I took 40 days prayer and fasting that God would heal and she would walk. Then I just kept quiet. My husband has always been a good sport.
Being totally dependent, they need us to get up 7 or 8 times each night. Our aim is to give them courage and insight to accept the dependency without being depressed. We are fortunate in being financially able to have the services of servants. Whereas children will try to dominate parents, the girls can vent their feelings on the servants who are part of the family by now.
Even then, the presence of one of the family members is essential. Sunday is a hard day for us.
What is your response to the meaning of suffering?
There is no meaning, no purpose, only blackness.
Nurse, how do you help in this situation?
Take my life and let it be consecrated, Lord, to thee.
Hey, how's my good friend today?
I'm ready to show my strength.
The main reasons for doing physiotherapy exercises is to retain muscular activity, mold body muscles, to prevent further deformity, to strengthen, stimulate, stretch, and relax muscles.
Hand grip exercises help to retain hand movements and grip, as well as strengthen the grip and movement of my fingers. Arm movements help retain muscle activity and firmness because I cannot use my arms or shoulders. Shoulder movements help to maintain body posture and stimulate the flow of lymphatic fluid from the axillary and submandibular lymphatic nodes. Controlled deep breathing is essential because I am unable to stretch my thoracic muscles and rib cage to adequately expand my lungs. Adequate lung expansion is necessary for good oxygenation of my brain, vital centers, and my whole body. It is also important to ensure adequate venous return with effective reoxygenation. Gluteal muscles must be contracted and relaxed at least 3 times each day when in the wheelchair to maintain blood circulation and prevent pressure sores. Leg and foot exercises are essential to prevent muscle cramps and varicose veins due to impaired venous return because of sitting in wheelchair with legs and feet constantly dependent and immovable. Passive leg, ankle and toe exercises with the movements of extension, flexion, abduction, adduction and circumduction all help to prevent edema and joint stiffness, especially around the knees and the ankles, which may cause increasing deformities such as foot drop. They also prevent pressure sores. Occasional altering of the position of the legs and feet while in the wheelchair also helps.
Stretching and holding the back muscles in extension for 10 seconds helps with the readjustment of body alignment, which has been restricted by sitting in one position in the wheelchair.
I always enjoy my exercise time because I feel good and relaxed.
Ishu knows the value of exercise physiology.
Physiology equals function. Exercise physiology equals the changes in cell and organ function during muscular activity. Regular exercise helps keep bone, muscle, and other tissue healthy. To prevent the development of contractures, foot drop, inflammation and breakdown of tissue over pressure points, and muscle and position exhaustion. In order to maintain, by promoting the best body alignment that is possible for the head and neck, thorax, shoulders and back, arms, elbows, hands and fingers, thighs and knees, as well as lower limbs, ankles, feet, heels and toes.
With lack of access to resources, the wheelchair-bound person is doubly handicapped.
Government and NGOs state that the funds have been made available for improving public access, but there is little or no evidence of value for money. My parents' determination and car gave me access to school and computer training. But what about the many wheelchair-bound whose parents are financially limited and do not know where or how to access help? There is hope for broken, grieving families, for poor, uneducated people whose feelings and sensitivities are constantly oppressed. What about planning committees? How many physically challenged people, nurses and physiotherapists are actively involved and their input action? The Siri Fort Complex and India International Center show that nothing is impossible where there is vision, understanding and compassion, not pity. Let us not make our hearts like flint, refusing to hear the law.
Midwives and nurses attending antenatal mothers, nurses in well-baby clinics, children's wards, pediatric outpatient departments, public health nurses, and all nurses in community health programs. Alert, sensitive nurses are the first professional health workers to bring help and encouragement to parents as they prepare the child for the doctor's examination, and after consultation, encourage parents in the ongoing management of breathing and other exercises.
The majority of nurses do not have access to the internet, but all nurses should have ready access to the Lippincott Manual of Nursing Practice.
The clinical manifestations so clearly outlined in the Lippincott Manual provide a clear picture for nurses to relate to a child or an older patient's clinical signs and symptoms and to the doctor's notes. The more effectively nurses and doctors discuss together will they give positive practical help to parents with full consideration of the patient's need to know what and why, irrespective of age.
Time is a gift from God, to be used by nurses for His glory and the good of every patient. Every nurse has time constraints. The concerned, caring, compassionate nurse who consecrates every minute of her day and her patients to the Creator of man and time will more effectively manage time. She will have sufficient time and grace to support these parents and children in all priorities of care.
Nursing assessment will be reflected in the management of personal grief by parents with positive adjustment to the painstaking perseverance of care and exercises with no visible improvement. Communion with patient and his or her family is a direct gift from the Creator of all mankind. It is rooted in the love of God, but not in religion. Effective nursing assessment requires vertical communion with God and lateral communion with the patient and her parents, skilled observation and sensitivity in feeling the patient's body and limbs for muscle strength, early recognition of actual and potential skill development for daily living, seeing and hearing the real need of the patient's parents or caregivers.
Nursing diagnosis reflects the nurse's decision-making skill that comes from what she has seen, heard, touched, and smelled. It incorporates both objective and subjective assessment to facilitate lifestyle adjustments whenever a sensory organ is not functioning at optimal level. Nursing diagnosis is essential if there is to be effective communion between all professional health workers. Communication is the sharing of opinions. Communion is a vital link in deeper sharing that conveys caring, comforting, trust, and the healing love of God. It is the basis of effective nursing management of patient care in hospital, in the home, and in the community. It complements and builds on the doctor's diagnosis to ensure the patient and his family are adequately helped to manage the trauma of muscular dystrophy without the added trauma of complications.
Nursing interventions are the applied art and science of nursing based on a deliberated problem-solving approach to meet the specific healthcare and nursing needs of patients, and are the central focus of the interrelated, interdependent, and recurrent steps of the whole process of nursing for each patient and his family. While nursing interventions will vary according to the type and severity of muscular dystrophy, the principles of management do not change. Maintaining good breathing pattern, swallowing and cardiac output, preserving optimal motor function, encouraging diversional activities, preventing crisis situations, and assisting in good health maintenance. All require consistent and wise encouragement, guidance, and teaching. The Lippincott Manual and Nursing with a Difference modules both give good guidelines.
Effective nurses identify with at least 4 care-related communities. The community of those with faith in a loving, just, and merciful God. Nursing, healthcare providers, and the broken. Community building is an important process in nursing. It speaks of relatedness, vertical to God, then horizontal to encompass all with whom nurses interact. It motivates by recognizing that God uses many gifts, ministries, and disciplines in the work of healthcare delivery. It addresses the issues of quality of care and allocation of resources to values of true justice and mercy. Within the community of faith, we receive power that comes from God's promise, the Helper, the Holy Spirit. Within the community of nursing, we receive and contribute to knowledge that enriches the whole process of nursing. Within the community of healthcare, we learn and build healthcare that is accessible, just, and respecting of the sanctity of life. Within the community of the broken, we learn compassion, hope, and the richness of the mercy of a just and loving God. Seeking good means breaking down barriers by praying for, giving to, receiving from, and being blessed.
At age 25, Ishu has helped more than many able-bodied men and women. She has used her skills to contribute to the health and well-being of the community of physically disabled through her services to MESH. She helps her father in his business. She helps professional nurses and others develop computer skills. She enriched the international community, including embassy personnel. Her dependency provides income and a home for helpers, and income for doctor and physiotherapist. With increasing insight into the meaning and purpose of suffering, depression, and in an abundant life, Ishu could bring a new dimension of wisdom and counsel to millions of physically challenged people in this nation and the neighboring nations.